Welcome to the Health Risk Reduction module for trainers. We've designed this as a companion to your trainer's guide to help you visualize the recommended steps for sharing information about reducing health risks effectively. As a trainer, your goal is that by the end of the session, participants will be able to define the goals of health risk reduction, list the risk factors for high cholesterol, high blood pressure, and high blood sugar that can be reduced, identify ways to reduce health risk factors in order to prevent or control high cholesterol, high blood pressure, and high blood sugar, and prepare an action plan. Here's a quick overview of the flow of a complete health risk reduction session. The introduction should take around 10 minutes. A discussion titled, "Why Reduce Health Risk Factors?" should take around 15 minutes. The first group activity should take around 20 minutes. A discussion about ways to reduce health risks should take around 15 minutes, and the second group activity titled, "Making the Connection" should take around 20 minutes. Allow 5 minutes for discussing the action plan, and closing the session should also take around 5 minutes. You may decide to omit these 2 items if you're conducting a 60-minute version of the session. Now that you've seen the big picture, let's talk about the materials you'll want on hand before your participants arrive. Here's a checklist of materials that'll help the session go smoothly. Check that you have a flip chart, markers, pencils or pens, name cards, and optionally refreshments. There are 2 handouts for this session, an action plan for reducing health risks and Health Risk Reduction, What You Need to Know. Print out enough copies for all of your participants before the session begins. There are also activity cards and a worksheet. Print 1 copy of each of the 3 activity cards. Each of 3 teams will get 1 card. Print enough copies of the Making the Connection worksheet so that each participant will have a copy. You'll find all originals in the printable materials section of your trainer's guide. Lastly, prepare an attendance sheet so your participants can sign in when they arrive. With your materials in order, you can begin introducing the session. Topic A of the Trainer's Guide covers everything you'll need for getting the session started. As the participants enter the room, greet them warmly to create a welcoming atmosphere. Ask each person to sign the attendance sheet. Write each participant's name on a name card and make sure the card can be seen. After all participants are seated, introduce yourself formally to the group. Ask participants to introduce themselves and provide a simple guideline about what information they should share. For example, you might ask that they state their name, their hometown, and a favorite hobby. After the introductions, explain that the session will last 60 minutes or 90 minutes, depending on the time you've allowed, and tell the participants what they can expect. You can state that there'll be group discussions about the benefits of health risk reduction, activities for exploring what can be done to help prevent or control high cholesterol, high blood pressure, and high blood sugar or prediabetes, and a variety of activities for sharing ideas about reducing risks for heart disease, stroke, and diabetes in a fun way. Make a special point to encourage participants to ask questions at any time during the session. Remember to mention where the restrooms and water fountains are, especially if there are participants who are unfamiliar with the location. Before you begin the actual content of the session, Ask the participants for suggestions about setting some ground rules for the next hour or 90 minutes, and write their suggestions on the flip chart. Keep the rules visible someplace in the room throughout the session. Your group is likely to come up with their own ideas, but typically it's good to include turning off cell phones, keeping all discussions during the session confidential, feeling free to ask questions, and avoiding sidebars by directing all questions to you or to the entire group so that everyone can hear the discussion. Unless you're running a 60-minute session, in which case you'll go directly to the activity cards segment in Topic C, the first group discussion is titled, Why Reduce Health Risk Factors? You can start the first group discussion of the session by asking everyone 3 questions. What is a health risk factor? Can people eliminate their health risk factors? And what is the benefit of reducing health risk factors? Use a new sheet on the flip chart to write their responses. You'll find complete information to supplement their responses in the Key Points box for Discussion B in the Trainer's Guide. You can use the key points to encourage group discussion if participants are silent at first. For the question, what is a health risk factor? You can share the information that when talking about health, a risk factor is anything that makes it more likely that we'll develop a medical condition such as diabetes or heart disease. A risk factor may also make a condition progress more quickly. For the question, can people eliminate their health risk factors? While some risk factors, such as age, heredity, gender, and race, can't be changed, other risk factors may often be controlled and modified to reduce your chances of getting heart disease, diabetes, and stroke. Tell participants that you'll be spending time today talking about the health risk factors that can be controlled. For the question, what is the benefit of reducing health risk factors? Explain that many chronic diseases that affect the U.S. population, such as diabetes, heart disease, and stroke, may be avoided or delayed by reducing health risk factors. Because almost 50% of Americans live with at least one chronic illness, risk reduction programs focusing on these areas have the potential to improve quality of life and productivity, reduce the impact of disease, and extend the healthy lives of individuals. When you share this information with the participants, avoid reading the key points word for word. Instead, speak naturally and maintain eye contact. The first group activity is item C in the Trainer's Guide. The purpose of this activity is to guide participants towards understanding the controllable health risk factors related to heart disease, stroke, and diabetes. You'll need pens or pencils for the participants, your markers, the flip chart, and 1 copy of each of the 3 activity cards. We'll outline the process for this activity and then talk about the key points to cover. Explain to participants that during this activity, they'll learn about which controllable health risk factors are related to heart disease, stroke, and diabetes. You will find sample instructions for introducing this activity in the Trainer's Guide. You'll use your own words, but you can begin with something like, now to start, we're going to conduct an activity. It'll be fun and easy, so please try to relax and let me explain what we'll be doing. Divide the group into 3 teams and give each team an activity card. Give participants 5 minutes to read, Discuss the information on the cards, choose which risk factors contribute to the subject of their card, and then answer the question listed on the bottom of their card. Let the teams know when the time is almost over and notify them about 2 minutes before the time is up. Ask participants to select one member of each team to present to the group. This person should explain the information on their card and share their team's responses to the questions. After each team finishes their presentation to the group, your responsibility as facilitator is to clarify or provide additional information. The Key Points box for Activity C includes everything that should be covered by the facilitator or the group during the activity. Activity Card 1 is about high cholesterol. The key points include that high cholesterol is one of the major risk factors for heart disease. Decreasing cholesterol levels can lessen the risk of heart disease, heart attack, or stroke. Deposits of cholesterol can contribute to plaque formation, which narrows blood vessels, reduces blood flow, and leads to blockage. A blocked blood vessel going to the heart can cause a heart attack, and a blocked blood vessel going to the brain can cause a stroke. There are 3 non-modifiable risk factors which can lead to high cholesterol: heredity, age, and being female. If your parents have high cholesterol, you're more likely to have it too. As we age, LDL levels tend to rise, especially after 55. For females, after menopause, women are likely to have higher LDL levels than men. Share with participants that high cholesterol has no signs or symptoms. Let them know they should make sure to ask their healthcare provider how often to have their cholesterol checked. For some people, it may be every 5 years. For others, the healthcare provider may check their cholesterol every year or more often. Here are the correct answers to the questions on the high cholesterol activity card. The factors that can put you at risk for high cholesterol are being overweight, too much fat in the diet, using tobacco, not getting enough physical activity, and not taking medicine as prescribed. Too much stress may put you at risk for high cholesterol because stress can increase some activities like eating an unhealthy diet, smoking, and not exercising regularly. There is no known association with drinking a moderate amount of alcohol and high cholesterol. The answer to the question, "Are these risk factors under your control?" is yes. Activity Card 2 is about blood pressure. The key points include that high blood pressure is one of the most common health problems healthcare providers diagnose and can cause other health problems, including heart attack, heart failure, stroke, and kidney disease. Share with participants that their blood pressure may be checked by their healthcare provider or by themselves by using a standard or electronic blood pressure machine. Blood pressure should be checked at least every year by their healthcare provider. Normal blood pressure for most people is 120/80 or less, but each person's healthcare provider can tell them what a healthy blood pressure is for them. There are 3 non-modifiable risk factors which can lead to high blood pressure: race, heredity, and age. High blood pressure tends to occur more often, earlier, and be worse for African Americans and people of Hispanic descent. For heredity, if your parents have high blood pressure, you are more likely to have it too. For age, the older you get, the greater the risk for high blood pressure. Share with participants that high blood pressure doesn't usually cause symptoms. We may not know whether we have high blood pressure until our blood pressure is measured. People who have extremely high blood pressure may have headache, blurred vision, chest pain, dizziness, nausea and vomiting, and/or shortness of breath. Here are the correct answers to the questions on the high blood pressure activity card. The factors that can put you at risk for high blood pressure include being overweight, because being overweight or obese increases the risk for high blood pressure because the more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. Using tobacco, because the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow, increasing your blood pressure. Risk factors also include not getting enough physical activity, because lack of physical activity also increases the risk of being overweight, and drinking alcoholic beverages, because over time, heavy drinking can damage your heart. Having more than 2 or 3 drinks at one time can also temporarily raise your blood pressure. High levels of stress can lead to a temporary, but dramatic, increase in blood pressure. Not taking medicine as prescribed can increase the risks, as can too much salt in your diet, which can cause the body to retain fluid, which increases blood pressure. Too little potassium in your diet can increase the risks. If we don't get enough potassium in our diet, we may accumulate too much salt in the blood, and untreated sleep apnea is a known risk factor for medical problems such as high blood pressure, heart failure, diabetes, and stroke. The answer to the question, "Are these risk factors under your control?" is yes. Activity card 3 is about high blood sugar. High blood sugar, or blood glucose, is a condition in which the blood sugar level is higher than normal, but not high enough to be classified as type 2 diabetes. It's sometimes known as prediabetes, a stage that often occurs before diabetes. People with high blood sugar or prediabetes increase their risk for type 2 diabetes, heart disease, and stroke. For people with diabetes, the risk for other complications such as kidney disease, nerve and vision problems are also increased. There are 3 non-modifiable risk factors which lead to high blood sugar that you can't control: family history, race, and age. If you have a blood relative with diabetes, your risk for developing it is significantly increased. People of African, Asian, Hispanic, and Native American descent and Pacific Islanders have a greater risk of diabetes. The older you are, the higher your risk. People 45 and older are at higher risk. People often don't know they have high blood sugar. There are no symptoms, and prediabetes can only be diagnosed by a healthcare provider using a blood test. Even though there are no signs of high blood sugar, damage to your body may be occurring, such as increasing your risk for heart disease, stroke, and diabetes. If you have diabetes, you may have symptoms such as increased thirst, need to urinate, blurred vision, cuts or bruises that are slow to heal, tingling, numbness in the hands or feet, recurring skin, gum, or bladder infections, or a feeling of being tired most of the time for no apparent reason. Here are the correct answers to the questions on the high blood sugar activity card. The factors that can put you at risk for diabetes or prediabetes include being overweight. If you're 20% or more over your optimal body weight, you have a higher risk of developing diabetes, especially if the excess weight is around the waist. Using tobacco is a risk factor, as is not getting enough physical activity. Being more active lowers blood sugar levels by helping insulin to be more effective. Drinking alcoholic beverages is a risk factor. Having more than 1 drink a day for women and more than 2 drinks a day for men increases the risks. Stress may be a risk factor for diabetes if it causes overeating, use of tobacco, drugs, or alcohol, or avoiding physical activity. Not taking medicine as prescribed is a risk factor. If your healthcare provider prescribes medicine for high blood sugar, it will only work if you take the medicine as you're instructed to. High blood pressure increases your risk for diabetes. However, drinking coffee does not increase the risk for diabetes. The answer to the question, "Are these risk factors under your control?" is yes. As you go over the key points, remember to maintain eye contact with the participants. Conclude this activity by thanking everyone for their participation. Unless you're running a 60-minute session, in which case you'll go directly to item E, making the connection, the next group discussion is titled Ways to Reduce Health Risks. The purpose of this discussion is to provide participants with information about different ways to reduce their risk for heart disease, stroke, and diabetes. You'll need your markers and the flip chart. Begin a group discussion by asking participants, what is the benefit of knowing the risk factors that you can't change? And how can you reduce your health risks? Write their responses on the flip chart. You can use the information in the key points box in the trainer's guide to encourage group discussion. The key points begin with an answer to the question, what's the benefit of knowing about risk factors that you can't change? Some risk factors, such as your age, gender, heredity, and race, can't be changed. But if you're aware of these risks, you can avoid adding risk factors that you do have control over. For example, if your dad has diabetes, it's even more important for you to eat well, exercise, and maintain a healthy weight. The key points include how you can reduce your health risks. High cholesterol, high blood pressure, and high blood sugar are all controllable risk factors that can lead to heart disease, heart attack, and stroke. In addition, high blood pressure and high blood sugar can cause kidney and eye damage. So, when you reduce these risk factors, you're also reducing the risks of having these other conditions. Share with participants that ways to reduce their health risks include keeping blood pressure, cholesterol, and blood sugar at normal levels, eating healthy, losing weight or keeping a healthy weight, getting regular exercise, not smoking, reducing stress, and taking any medicines that have been prescribed for you. Since high blood pressure, high cholesterol, and high blood sugar often have no symptoms, you might not know if you're at risk. That's why it's important to see their healthcare provider every year to be checked out and see how they're doing. Remind participants to ask their healthcare provider what their blood pressure, cholesterol, and blood sugar levels are. Remind them that it's a good idea to ask if their weight is healthy or not, and also ask for suggestions about what they should be doing to avoid risks. As before, try to avoid reading the content word for word and establish eye contact with participants. The next activity is item E in the trainer's guide, and it's titled Making the Connection. The purpose is to guide the participants through a brainstorming session. This can help them analyze the elements of a healthy lifestyle that includes regular exercise, eating healthy, stop smoking, reducing stress, and taking medication as prescribed. You'll need your markers, the flip chart, and enough copies of the Making the Connection worksheet for each participant. You'll also need the facilitator version of the worksheet. To begin the activity, give each participant a copy of the Making the Connection worksheet. Explain to the participants that they have 5 minutes to draw lines that connect each of the numbered sentences to an item in a circle. Tell them that some of the circles will have more lines going to them than others. Explain that you'll let them know when the time is almost up, and let them know that you'll review each item as a group when everyone is finished. When you discuss each item, refer to the worksheet for the facilitator in the printable materials section and the key points for activity E to clarify or add any missing information. Let the participants know that the worksheets are theirs to take home. The key points in your trainer's guide groups the information by the 9 items in the list. Items 1, 6, and 8 on the worksheet all pertain to exercise. Share with participants that besides lowering health risks, regular exercise can increase muscle tone and give you more energy. Regular exercise is any physical activity that you can do almost every day. It can be simple things like walking, gardening, and stretching. Remind participants that before they start any new exercise program, they should talk with their health care provider. Choose exercises you enjoy and add them to your daily routine. Choose different types of exercises. Endurance or aerobic exercises, such as walking and dancing, make your heart beat faster. Balance exercises help prevent injuries from falls and help strengthen body areas such as the upper thighs. Flexibility exercises such as yoga and stretching increase your range of motion, help keep your joints flexible, and reduce your chances of injury during other activities. Strength-building exercises, such as lifting weights and using resistance bands, make your muscles stronger and help to preserve strength, independence, and energy. Start slow and try to exercise most days of the week. Share that they should exercise for at least 30 minutes a day and that they may want to join an exercise class or exercise with their friends. An exercise plan should include talking with your healthcare provider to make sure you're making safe changes, keeping track of your exercising habits, sharing your progress with your healthcare provider, and changing your exercise goal when necessary. Item number 3 on the worksheet is matched with Manage Weight. Share with participants that being overweight or obese can lead to serious medical problems. These include heart disease, high blood pressure, high cholesterol or too much fat in the blood, stroke, type 2 diabetes, and certain kinds of cancer. Being active and eating healthy are the keys to losing weight. If you do want to lose weight, plan to lose slowly. The goal should be to lose about 1 to 2 pounds a week until you reach a healthy weight. Remind participants to be sure to talk to their healthcare provider for suggestions about losing weight safely. Items 2 and 5 on the worksheet are matched with Eat Healthy. Share with participants that healthy eating can help you maintain a healthy weight and lower the risks of developing high cholesterol, high blood pressure, and prediabetes. In return, you can lower your risk for heart disease, diabetes, and stroke. Remind participants to talk with their healthcare provider before making any changes to the way they eat. It's a lifelong process, but you can start by taking small steps. Healthy eating means eating a wide variety of foods that are low in sodium, fat, and cholesterol. Having a balance among food groups, and eating in moderation. Eat a variety of nutrient-rich foods. Your daily food selection should include vegetables and fruits, bread and other whole grain products, dairy products, and meat, poultry, fish, and other protein foods. Try to eat more fruits, vegetables, grains, and beans, and eat less red meat and fast food. Suggest to participants that it's good to eat moderate portions. Keeping portion sizes reasonable makes it easier to eat the foods you want and stay healthy. Balance your food choices over time. Not every food has to be perfect. If you eat a food high in fat, salt, or sugar, select other foods that are low in these ingredients. If you miss out on any food group one day, make up for it the next. Your food choices over several days should fit together into a healthy pattern. Share with participants that a healthy eating plan should include talking with their healthcare provider to make sure they're making safe changes, keeping track of changes to their eating habits, sharing their progress with their healthcare provider, and changing their goals when necessary. Item number 4 on the worksheet is matched with Manage Stress. Share with participants that many people feel stress at some time in their lives. When you have to deal with more things than you're used to or things you don't expect, it can cause stress. It can be due to many different causes such as family problems, life changes like having a baby, work, money issues, or having a health condition like diabetes. Everyone handles stress in a different way. What may cause stress for one person may not cause stress for another person. It isn't known whether stress causes heart disease, but acute and chronic stress may affect other risk factors such as high blood pressure, high cholesterol, eating, smoking, and lack of exercise, all of which increase the risk for heart disease, diabetes, and stroke. Share with participants that to help relieve stress, they can try to relax and reduce tension. Try to think about what causes stress in your life and try to avoid it if possible. Find time to do things that you enjoy, like taking a walk, listening to music, going out with friends, or reading a good book. You can also take a few slow, deep breaths. Stop and count to 10 before you react or say something. Take a warm bath or shower. Meditate, do yoga, or talk to your healthcare provider for help. Item number 9 on the worksheet is matched with Take Medicines. Share with participants that medicines are often prescribed by healthcare providers to help people control high blood pressure, high cholesterol, and sometimes high blood sugar if there are symptoms of diabetes. In order for the medicines to work properly, it's important to follow instructions from the healthcare provider or pharmacist. The key points include things to do to help people take their medications the right way. Share with participants that if they get a new prescription, they should ask their healthcare provider or pharmacist the following questions. What is the name of the medicine? What is the medicine for? How should I take it? When should I take it? What are the possible side effects? What do I do if I miss a dose? In addition, ask participants to also consider taking these additional steps. Read and understand the directions on the prescription bottle label. Let their spouse or family know what medicines they're taking. Keep a list of their medicines in their wallet or purse and go to one pharmacy for all of their medicines. Use a pill box to help organize their medications. And if they can't take their medications as prescribed, ask their healthcare provider or pharmacist for help. Item number 7 on the worksheet is matched with smoking. It is the #1 preventable cause of premature death in the United States and may cause lung cancer and many other health problems. This topic addresses the importance of having an action plan. Distribute an action plan to each participant, then ask each person to review the items on the plan and select one or more items that they'll try to change or improve. The choices on the action plan include get your numbers, decide to eat healthy foods, stop smoking, control stress, keep moving, and take medicines as prescribed. The key points about the action plan in the Trainer's Guide recommend that you emphasize the importance of an action plan and how it relates to improving and maintaining a healthy life. Share with participants that lifestyle changes are made one step at a time. Therefore, they should be ready, willing, and able to make changes that will improve their chances for a better and healthier life. Explain that there are 4 questions you'd like them to ask themselves based on what they selected on their action plan. They are: what behavior would I like to change? Is it a behavior that I can do? What must I do to achieve this change? And when will I make this change? Ask participants to select their confidence level for the behavior they've chosen to change. Ask them to select a number on a scale from 1 to 10, with 10 being the highest, indicating how confident they feel about completing their action plan. If a participant's confidence level is less than 7, ask him or her to consider an easier plan. Conclude the session by distributing and explaining the Health Risk Reduction What You Need to Know handout. Invite the group to ask questions about the handout. Remember to thank the participants for their attendance and participation. Finally, invite them to return to the next session and encourage them to bring a family member or friend. Thank you for your contribution in sharing this important information, and thank you for participating in this training.